Good morning, Mr. Chair and members of the committee. Thank you so much. Really appreciate the opportunity to be here today to testify on behalf of House 1094. As you can see, both Senator Rush and I are committed to this process, committed to the individuals that will be here today advocating the bill, and I'm going to limit my conversation. I'm going to let Senator Rush make a comment, and then we're going to pass it off to Tom Healy, a constituent of ours from Dedham and one of the founding members of the organization that's formed out of the this overall process. And also we have Dr. Mark Varvares, Chief of Otolaryngology and Head of Neck Surgery at Mass Eye and Ear. This bill has been a multi-year process. We've filed it session after session. It's got the favorable report of this committee. And what we have today is an opportunity for us as legislators to make a difference for individuals who have already gone through significant trauma relating to medical conditions, cancer primarily, and which is covered by medical insurance, but then the result of the dental needs are not covered. Our friend here went through radiation therapy for carcinoma. It caused significant complications. The treatment that he suffered remains uncovered, and he's committed himself to making a difference, not only for what started out an effort with Senator Rush and I on his behalf, but for others. And again, as I mentioned previously, the organization that was born out of this process is called MOPSS, Massachusetts Oncology Patient Survivor, Survivors and Supporters. You're going to hear from individuals today who are going to share a lot of personal stories, and I have met with them. I've heard their stories. I feel their pain, and again, look to us in the legislature for an opportunity to make a difference. And we do believe that the timing is right, and this is something that we hope will have a favorable report. I said I'd be limited, and I apologize that I wasn't, but I want to turn over to my good friend and colleague, Senator Rush.
And I want to thank you, Mr. Chairman, and members of the committee. It's a pleasure to be with you this morning. And I'm here because Representative McMurtry, as we all know, is an extremely passionate advocate for constituents, and this is an issue that came to his attention. He, in turn, brought it to my attention, and certainly we learned a lot in the process and continue to learn a lot in the process. But Mr. Healy has done an unbelievable job in taking his personal experience and relating it to others throughout the Commonwealth to form this incredible network. So you're going to hear from him and others today, as the rep mentioned, and again, here to be fully supportive of the legislative endeavor and to try to get this to the governor's desk this session. Thank you.
Okay, so Mr. Healy.
Thank you so much. Thank you to Chair Murphy and Chair Feeney and the members of the Joint Committee on Financial Services for allowing me to come in and testify today. My name's Thomas Healy, and I reside in the town of Dedham. I just want you to know I wrote out at least 3 different times, what am I going to say to you? So I woke up at 4:47 this morning. I think my brain was spinning all night, saying, what am I going to say? And it's because there's so much to say. So whatever I wrote down, here we go. So it's been a long year for our group, but it's been a very productive year. We, the Massachusetts Head and Neck Cancer Survivors and Supporters, also known as MOPSS. I want to stop for a second to say that last year we had 3 letters of support. We were able to advance House Bill 1154 over to the Joint Committee on Financial, Joint Healthcare Committee and Joint Care on Financial Services, and we hope to do that again this year. So I hope we take the time, you take the time to read those very supportive and important documents that we've submitted to you. Because in those letters, we have support from all the way down the Cape, from Cape Cod Healthcare out to the western part of the state, UMass Memorial, and many more, including the Boston area, Mass General, Dana-Farber, and many others. All right, I'm just going to jump over to this one. Thank you. So Massachusetts House Bill 1094 will require insurers doing business in our state to provide coverage for medical-related dental treatments. I'd like to read into the record a statement I wrote in 2020 before the Financial Services Committee on House Bill number 1053. This affects thousands of people in our state. If something is not done to expand coverage of dental procedures as a medical necessity in the near future, there will be thousands of people going through the doors at all of the oncology treatment centers or hospitals who otherwise will face unavoidable health risk. I'm asking you today to advance House Bill number 1094, like we did last year, over to the Joint Committee on Health and Financial Services. Lastly, I'd like to thank all of my new friends that are with us today. We've done so much hard work to share. I want to just say one more thing. We're only going to get bigger. We started out with me as one, and then we went to 3. Theoretically, our group is up to 30 hospitals or other institutions in the state, like the Mass Society of Otolaryngology, the Mass Society of Oncologists. If this doesn't work this year, there's 159 hospitals across the state. Not one hospital that I've reached out to over the last 2 years has said no. That's telling me that forever how long this goes, we will have all 159 hospitals, and I'm hoping that we can somehow get the mindset of the regulatory agencies here in the State House to take a great look at it and say, let's see what we can really do. So I thank you for your time. Thank you so much.
Thank you, Mr. Healy, for that powerful and personal testimony. It really does mean a lot to us on the committee to hear that. We get so bogged down sometimes in the nitty-gritty and the details, and to have you come in and show the courage as a survivor, not only for what you've been through personally, but to be an organizer, to be bringing people together, means a lot to us on the committee, and it goes a long way, and appreciate that.
Thank you.
Thank you.
Good morning. My name is Mark Varvares. I'm a head and neck surgeon at the Massachusetts Eye and Infirmary. I'm the chair of the Department of Otolaryngology at Harvard Medical School, chief of the service at Mass Eye and Ear, and chief of the service at Mass General Hospital. I really appreciate the committee's time and attention to this very important matter this morning. I'll just take a moment to say I'm also a cancer patient. I'm in the middle of treatment for acute myeloid leukemia. I had a bone marrow transplant 103 days ago. But this issue is important enough for me to get out of quarantine and come and talk with you this morning. I've been taking care of head and neck cancer patients for over 30 years, and I've watched them struggle with this issue of dental coverage. It's very often the case that one cannot separate dental issues from medical issues in the care of the head and neck cancer patient. This challenge comes in many different forms. Here's a couple of examples. Many of our patients, as you know, have to have radiation therapy as part of their treatment. It's life-saving. That therapy comes at a cost, and I'm not talking about financial costs, although we're here to talk about finances. It also brings other issues down the road that directly affect their dental care and their dental health. So before radiation therapy, patients need to have a full dental evaluation and many times have to have dental extractions done, sometimes a full mouth extraction, which can be very, very expensive. Many patients can't afford it. Insurance oftentimes doesn't cover it. So many times patients forego dental care that's necessary before radiation and therefore don't get the radiation that they need. I have a patient in the last 2 years that fits this exact scenario. He had major surgery on his tongue to remove a cancer. He was referred for radiation therapy. The radiation therapist appropriately said you need to have dental care done. He went to a dentist. It was going to be thousands of dollars to get his teeth pulled prior to radiation. He just didn't do it, didn't get the radiation, presented to us with a raging recurrence. Fortunately, he was able to undergo chemoradiotherapy and right now is disease-free, but we know treating cancer the second time around is not as successful as the first time around. So this lack of coverage for patients to get basic dental care before their head and neck cancer treatment is threatening their survival. Something has got to be done about it. We see it over and over again. Here's another scenario. I'd like everybody in the room just to take their tongue and touch it to the top of their mouth.
I do that.
Okay? So the roof of the mouth is the floor of the nose. We have many patients with cancer either of the palate, the roof of the mouth, or the floor of the nose. In order to cure that cancer, we have to remove that common wall. Well, guess what? That means you have a hole that goes from your mouth to your nose. Okay? This can be easily managed with something called a surgical obturator. It's like a denture that pops into your mouth. These cost tens of thousands of dollars. I've had patients say they had to mortgage their home in order to get this covered. Patients should not have to do that. So in closing, all I'd ask is the head and neck cancer patient should be able to focus on getting better, not on worrying about getting coverage or paying their dental and medical bills. So I implore you, please, pass 1049 so our head and neck cancer patients can worry about getting better and not worrying about how they're going to pay their bills. Thank you.